Embryo transfer. Embryo transfer is a minor procedure that aims to replace one or two embryos into the woman's uterus. This can either be done through a fresh or a frozen cycle. Although chances of success increase with transfer of more than one embryo, the risk of having a multiple pregnancy also increases. 1 in 4 in vitro fertilization pregnancies end up being multiple pregnancies, compared to 1% in naturally conceived pregnancies. Transferring more than one embryo increases the risk of a multiple pregnancy. Women with multiple pregnancy may face higher risk of miscarriage, fetal anomaly, low birth weight or intrauterine growth restriction, preterm delivery, complications during birth, preeclampsia, gestational diabetes or postpartum hemorrhage. Singapore's Ministry of Health allows a maximum of 2 embryos to be transferred at any one time. An elective single embryo transfer is recommended if the patient meets the following criteria, as the likelihood of conceiving with one embryo is as good as with a double embryo transfer without additional risks. The embryologist will grade the embryo as it is growing based on microscopic assessment. Embryo transfer can be done either 3 to 5 days after the oocyte retrieval, or be frozen after fertilization and planned for transfer at a more suitable time when it is safer for the woman to receive. With fresh embryo transfer, progesterone medications will be prescribed to improve the chances of implantation. Frozen embryo transfer is done under the following indications: for planned pre-implantation, genetic testing and fertility preservation, or unplanned situations such as ovarian hyperstimulation syndrome, uterine abnormality, complications of oocyte retrieval, or when pregnancy needs to be deferred for medical or social reasons. There are 2 options for transferring the embryos into the woman's uterus. The natural or ovulation induction cycle is a viable option if the woman's menstrual cycle is regular. Her cycle will then be monitored closely with transvaginal ultrasound scans and blood tests for serum luteinizing hormone levels to confirm ovulation. This will allow the IVF specialist to plan the best time for embryo transfer. Following the transfer, the embryo implantation and development is supported by the progesterone hormone released by the naturally formed corpus luteum. If the woman has irregular menstrual cycles and is keen to go through the ovulation induction cycle, ovulation induction medications may be given to simulate a natural cycle. Embryo transfer using natural cycle does not require medications and costs less than medicated frozen thawed embryo transfer. However, this method involves more visits to the clinic for ultrasound scans and blood tests. It requires that ovulation is affirmed, but due to biological variation in every woman, the transfer may be cancelled if ovulation does not occur in the planned cycle or when no dominant follicle is seen. Cancellation occurs in up to 15% of cases. Abstinence or barrier contraception is recommended to reduce the risk of multiple pregnancy through natural conception. Ovulation induction is an alternative for anovulatory women who decline standard medicated embryo transfer procedures. However, there is a risk of ovarian hyperstimulation syndrome with the use of gonadotropin injections. Clomiphene may also have an adverse effect on the uterine lining. Medicated cycle is the other embryo transfer method. This is done by regulating the woman's menstrual cycle with hormonal medications. The woman is given about 2 weeks of estrogen, followed by progesterone, to ensure that the uterine lining is thick enough and ready for the embryo transfer. This will usually require 1 to 2 transvaginal ultrasound scans to assess the thickness of the uterine lining. The dose of the medications may then be adjusted according to the ultrasound finding. Advantages of the medicated cycle include having flexibility in choice of the day of embryo transfer, With lower cycle cancellation rate and the ability to adjust dosage of hormonal medications according to the results from the ultrasound scans. This method is also suitable for women who do not ovulate. The disadvantages of this method is that it is more costly than natural cycles and will require prolonged course of hormonal medications with increased risks of adverse effects from medication. Embryo transfer is a day surgery procedure but will not require any sedation. This procedure is usually painless. The embryo transfer will be done under transabdominal ultrasound guidance to allow the IVF specialist to place the embryo in the area of the uterus with the highest chance of implantation. A full bladder is needed for this procedure. This allows the uterus to straighten out and make it easier to introduce the soft catheter. It also makes visualization of the uterus under ultrasound easier. The patient's identification details will be checked before the transfer. A speculum will be inserted into the vagina to visualize the cervix. The cervix will be cleaned to remove any mucus from the cervical canal. A soft catheter containing the embryos are inserted into the uterus. Once the catheter is optimally placed, the embryos will be transferred. The catheter will then be removed and checked by the embryologist to ensure all the embryos have been replaced. After the procedure, the patient should reduce stress and be on hospitalization leave until planned pregnancy test. There may be some lower abdominal discomfort or mild vaginal spotting after the procedure. The patient will be able to check for the pregnancy outcome of the transfer about 16 days after the embryo transfer by doing a blood test to check or beta HCG level. With a positive result, additional estrogen and/or progesterone medications may be added on for luteal phase pregnancy support. This will be in the form of oral, injection, or vaginal tablets. An antenatal visit with an ultrasound will be arranged in about 2 to 3 weeks after a positive pregnancy test to ensure implantation and to evaluate for any multiple pregnancies or early pregnancy complications such as ectopic pregnancy or miscarriage risks. In the case of a negative result, progesterone supplements can be stopped and an appointment with the IVF specialist will be arranged to discuss further course of action. If there are equivocal results or bleeding, a repeat test may be done after 2 days. Possible complications of embryo transfer include failure of embryo implantation, difficulty or failure in transferring the embryo due to technical issues such as stenotic cervical os or convoluted passage within endocervical canal, infection, early pregnancy complications like miscarriage, ectopic pregnancy or fetal anomaly, or multiple pregnancy. With frozen embryo transfer, there is also an additional risk with a failure of embryo surviving thawing. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.